patients that typically have this procedure go home the same day. I would say about 85% go home the same day, and they're walking full weight right away. And the other 15% go home the following day in the morning. What they need is physical therapy. Typically, we have patients do therapy pre-surgery, so they're ready and they understand what's expected of them. And then immediately after surgery, they will have some therapy at the facility, at the hospital, and they'll have therapy typically the following day as outpatients. And this allows patients to be much more functional, much more active. With regard to the level of pain, clearly this is obviously surgery, so it is somewhat painful, but with the local blocks that are given by the anesthesiologist and the pain medication that's given post-surgery, patients are very comfortable at home and very comfortable walking around their house and being much more active than you would think. As far as driving, usually you're allowed to drive as soon as you're not taking any painkillers during the day, and some people can drive after a week, and most patients are driving by 2 weeks. As far as returning to work, most patients can return to work if they have a sit-down job. They can work after about 2 weeks, sometimes a little longer, depending on the patient and depending on the demands of work. But most patients are back to work at 4 to 6 weeks. The higher the demand of the work, clearly the longer it may take. But I would suspect that heavy demand patients, it may be up to 2 to 3 months just to be safe. Patients really feel pretty good by 4 to 6 weeks. You still have some swelling. You're expected to have some swelling, but their mobility is quite good, and that's what most of these patients tell us. They're like, wow, I've had friends who've had full knee replacements and they're really struggling with their mobility. They are in a lot of pain and it's been a month or 6 weeks. And so this type of procedure, since it's less invasive, less bone damage, and you're not removing ligaments, they tend to be much more active and happier with the level of discomfort and pain that they have by about 4 to 6 weeks. As far as other activities they're allowed to do, they can play tennis, they can play golf, they can swim, they can bike.